Well, welcome everybody. We'll have more to join us to the Biomechanics Summit 23. Here we are. It finally came. I'm really looking forward to a crackerjack lineup. Our first speaker is going to be Nachi Chocklingham. He's out of Strathshire University and has done a lot of biomechanics research with the World Health Organization. Before we get to his talk, though, I've got a couple people that I want to just mention thanking for the help and also helping with some sponsorship. First, Rita Yates. Rita isn't signed in yet, but thank you, Rita, for helping to get this out to Academy membership. We have a meeting coming up with the American Academy of Podiatric Sports Medicine, and a lot of people that are here are members. And Mike Donato is going to tell us when that is momentarily. And the one sponsor that we have is a speaker, Brian Kentner. He's going to be talking with his company, the 3D Printed Foot, later in the program. And then with the advent of different sorts of compression sleeves and braces over the last decade, I've had the pleasure of working with Dave Higgins. Our relationship started with a sock article that I wrote with Podiatry Management. And Doug Ritchie had done a lot of diabetic sock research, and they collaborated, and we were able to get some things on sizing and venting and for diabetics, and we reviewed some of that info. And now in more recent times, Dave has pioneered getting wicking fabrics with compression splints, and this is just a prototype of something we did called turf toe splint, the TT3, and this is something we developed a couple years ago, but he has something he's going to touch on as we get people admitted here with a plantar fascia compression sleeve system that's kind of a package. And welcome, Dave, and tell us a little bit about this this nice little kit that you have for plantar fasciitis, one of the more common things that we see.
Well, thank you, Ben, and thanks to everyone for the opportunity to just say a few words. And I wish you a very successful conference here. So OS First is our company and our brand. And about 13 years ago, we created the idea of using compression therapy in products.
Did your mom put you to work?
Orthopedic benefits.
Okay.
Kenya, can you please just mute your...
Are you going to get paid?
Kenya, can you please mute your...
Do you need a paycheck?
Let me
you
just...
hear that, Mom?
Oh,
She needs a paycheck.
Okay, sorry about that, Dave. Dave, let's take it from the top. I'm sorry, I'll just cut that out.
That's all right. We all pay taxes. No problem. Again, my name is Dave Higgins, and I'm the creator of a company called OS First. And we design and manufacture compression therapy garments, but we're focused on orthopedic outcomes as opposed to just vascular outcomes. And we've grown this technology we call compression zone technology for some time, and it's quite a large and successful endeavor at this point. And Dr. Pearl has been a critical partner for us in our designs and functional developments of products. And he mentioned the turf toe product a little bit earlier. So what I'm just showing you here is a more recent development where we have a series of products designed for various levels of plantar fasciitis treatment and prevention. And so this just gives you an example of what compression zone technology is about. This is a product that mimics the kind of taping that many of you might do or learn to do for early stages of plantar fasciitis. This is an ongoing compression foot sleeve to help take away the pain and to improve the pressure relief of the natural fat pads through compression. And then we have performance sock products that we've developed with targeted compressions that are designed specifically to help prevention and ongoing care of plantar fasciitis. And we take this approach with almost all orthopedic conditions from the foot, ankle, all the way out to the wrists. And we've had great success with that. These are all focused Class 1 FDA products that are focused on palliative care, prevention, and pain relief. And as a result of that, we've had a great deal of success with this idea. I'd be happy to make contact with anyone that's here. You'll see the video. You can contact me, and I'll be happy to explain further and get you samples or information that you might be interested in.
And folks,
Thanks a lot, Dan.
anybody that's interested can also contact me as well. And I can tell you they do a nice job of giving you intro samples, just like we did with this is the prototype of the turf toe splint. The one thing that Josh, your son, had mentioned is that FS6, which I had used at night for patients, the DH3 that you have has a little less toggle pressure in the Achilles, and it's going to be, so it makes for less burning, for some people that have a little pressure point there. And that's the key is knowing the right grade of medical compression. And Nach, I know that we're going to bring you on in a moment, but one of the things that isn't necessarily in the meat of your discussion, but maybe you can just mention as a sideways glancing, is how pressure management with proprioception with things like compression sleeves also influences things within the foot and footwear. So that's something you have enough of a background where I'm sure you'll be able to freelance off your main slide presentation. So without further ado, let me introduce our first speaker, Nachi Chocklingham. He's a professor, and he's going to be talking to us about pressure management in footwear and in the foot. Please go ahead and get started with your program. We're looking forward to it.
Okay. Good evening, and thank you for the introduction, Ben. I hope you could see my screen.
Yes.
Okay. Good evening, and thanks for joining us. The topic of footwear and foot biomechanics is very vast, and I could discuss this for hours and days. However, I only have 30 minutes this evening, and so I'm trying to focus on providing a general overview of the field and setting the stage for other speakers. I think you've got a fantastic lineup for us. So some of the things that Ben just mentioned, probably we'll touch on it during after the presentation, probably with one or two of your questions. But for now, I've decided to focus on the broad understanding of the field rather than presenting results from specific studies. So in that context, that's the title of the talk. I'll try and keep it as general as possible, as I said, rather than trying to cover into specific results from any of our studies. What can you expect in the next 10-15 minutes? I'll provide you with an overview of the technologies to measure foot and footwear biomechanics, as well as some of the techniques and the data collected in research studies. I'll also touch on some specific experiments and the relevance to the field, and discuss the translational nature of our research using our own examples. To start the lecture off, I'll provide some basic information on foot and footwear biomechanics, including some structures and functions of the foot, probably impact of different types of shoes on the foot. And I'll also mention some common measurement techniques such as gait analysis and pressure mapping. I'll delve into the current state of the art, including the recent studies and advances in technology. Finally, I'll discuss some of the potential areas for future research and development with a focus on foot and footwear biomechanics, including new technologies, experimental methods, and applications for the field. I'm I'm quite used to running over time. So I think, Ben, if you could keep time, I usually keep talking. So if you could let me know how I'm doing for
I
time,
got
that'd
you
be great.
covered.
And as I said, we could elaborate on some of those topics after the talk. So to set the scene then, foot versus footwear biomechanics. Probably I'm talking to the converted here, but still I'll try and touch on my thought process. Foot biomechanics refers to the study of the mechanical functioning of the foot, including the bones, muscles, joints, tendons, ligaments, and all that. It examines how the foot moves and supports the body during activities such as walking, running, or jumping, or any physical activities. Footwear biomechanics, on the other hand, refers to how the study of shoes or footwear affect the mechanical functioning of the foot. That's how I define to some of my students. These include the type of shoes, the high heels or athletic shoes, for example, and how they influence the way that the foot moves and supports the body. And it also examines, the footwear biomechanics also examines how the shoe design and the materials can impact foot health and injury risk. And I'll give you some specific examples in the coming slides. So before we proceed, essentially, foot biomechanics focuses on the natural functioning of the foot and understanding the dynamics, while footwear biomechanics focuses on the impact of shoes on the foot. Both of them are very close to my heart. Both of them are important in understanding how best to support and protect this marvelous machine, as one of the philosophers said during our physical activity, walking or running. So understanding the difference between foot and footwear biomechanics is very important for several reasons. And that's the reason I'm kind of emphasizing this. The first couple of things, it's about foot health. By understanding the mechanical functioning of the foot, we can better understand how to support and protect it during the physical activity. And the knowledge of the foot biomechanics can help us prevent foot injuries and the overall foot health. On the other hand, footwear biomechanics, the shoe selection, understanding how different types of shoes affect the foot can help individuals to make more informed decisions while selecting shoes for different activities. And this is a key area for us in terms of pediatric shoes and the influence of footwear choice in the life course of girls and women, and we have got a particular program of work around that topic, and if time permits, I'll expand on that. The third thing that I want to highlight is the performance enhancement. This is where pressure and load measurement comes in as an important element. By understanding how shoes can impact foot mechanics, and by measuring load and pressure, we can design shoes that optimize the performance for athletes or for certain activities. It includes, when I say performance enhancement, I kind of loosely include foot orthotics into it too. Talking about foot orthotics, that's where the next link comes in, which is the injury prevention. So it's not just about the treatment of injuries, it's also about preventing injuries. And if you all as clinicians, when you assess these people who come into your clinics, understanding how shoes affect the foot can help prevent injuries caused by inappropriate footwear. So footwear protects, at the same time, it also creates trouble. So, and that's what links to Ben said about my work with the WHO. Most of my work within the WHO relates back to assistive technology and rehabilitation. So knowledge of foot and footwear biomechanics is extremely important and can be used to design rehabilitation programs, protocols, and appropriate clinical management for individuals with foot and ankle conditions. Last but not least, people like me who are lab rats. I'm very proud to call myself a lab rat in that sense. We spent a lot of time in the lab understanding the mechanics of the foot and how shoes impact it. Either it is casual footwear, everyday footwear, or running shoes. So all of that is extremely important. And that's the reason why I had a specific slide on this to highlight the difference between foot and footwear biomechanics. It's not interchangeable. They're distinctively different, and one needs to understand the differences. Now, the next setting the scene for me to give you the basics is the foot kinematics and kinetics. Both of them, some of you have heard me speak in this forum and other forums. Both kinematics and kinetics are important aspects of foot biomechanics. But the topic for this evening is about kinetics. So on the left, I've got various marker sets and about kinematics. Foot kinematics refers to the study, the movement of the foot, including its position, orientation, movement of joints, and in various physical activities. It typically provides you with a range of motion and the motion patterns of foot. Last time when I spoke here, I think I talked about coordination variability. So that's not the topic for this evening. In terms of foot kinetics, the study of forces or moments acting on the foot during movement is extremely important. This includes forces generated by the muscles, the forces transmitted through the bones and joints, and of course, the force exerted by the ground, what we call ground reaction force. So, although both kinematics and kinetics are important in understanding foot function and movement pattern, the kinetics is considered to be more important in our case because it provides specific information about the forces acting on the joint, which affects foot stability, balance, the ability to generate power, but also, more importantly, it can be related to the risk of injury. So, foot kinetics, such as the measurement of pressure, distribution, and muscle activity, can help all of us, researchers and practitioners, not only to design shoes, orthotics, but also can help support and protect the foot from any type of injuries. Now, in the context of foot and footwear biomechanics and kinetics, measuring force and pressure are kind of related, but they're distinct. Force refers to the amount of push or pull exerted on the object. In foot biomechanics context, force measurements are used to determine the amount of force exerted by the muscle, tendons, ligaments of the foot during various activities. It can also refer to the forces transmitted to bones and joints. And as I just said, it's also related to the ground reaction force. Pressure, on the other hand, refers to the force exerted over a specific unit area, surface per unit area. So in foot biomechanics, pressure measurements are typically used to measure or assess the distribution of forces across the foot. And this information helps us to understand how the foot is loaded and to identify the areas that may be the risk of injury, that may be at the risk of injury. So both force measurements and pressure measurements are important. Force plates is one of the technologies, and they measure the ground reaction force during activities, any type of activities. They typically consist of a flat surface, as you could see upon the screen, and the sensors measure the force exerted on the plate. They can provide information about the vertical, the medial lateral, or the anterior posterior forces or components of the ground reaction force. And they do help understand the mechanics of the foot and the impact of different types of shoes on the foot. On the other hand, on the middle there is the in-shoe pressure measurement systems. These kind of systems consist of sensors embedded in the sole or the insole of the shoe to measure the pressure exerted on different types of the foot, different parts of the foot, I should say. So in that sense, they can provide distribution of pressure across the foot and how it changes with different types of shoes or different types of foot conditions or pathologies. We also have pressure plate systems, pedobarography, as some people call it. It's a similar kind of pressure measurement, but it uses a pressure plate rather than an issue pressure system. Now, it's not just about the technology. I'm using this particular paper that you see up on screen as an example of how a structured methodology for data collection and reporting can be used to gain a deeper understanding, if you want to say it, of the characteristics of orthotic materials and how they affect gait. When we published this study, the main aim of the study was to improve the clinical decision-making process, or this program of work. The main aim was to improve the clinical decision-making process when it comes to orthotic materials. The results, when you download the paper, you got the full reference there, showed that the medium density polyurethane may have different loading characteristics, which could make it suitable for patients with compromised ability to deal with pressure. So this was the first ever paper to have some quantifiable information on PU footbeds for patients with diabetes. The reason why I'm highlighting this paper is I want to emphasize the importance of using structured methodology for data collection and reporting, and stress the importance of understanding how it's being measured in order to make informed decision. So on the left-hand side of the screen, you could see how we have split the foot into various regions. And if you see, most of our papers using plantar pressure measurement would have used similar type of technology. Similar type of technique, I should say, not technology. So whatever technologies we use to make the data comparable, we tend to use these type of masks in some systems, or areas in some system, regions in some regions of interest. So it's important that we use appropriate techniques to measure force or pressure. So in studying foot and footwear biomechanics, it's also on focusing on load or pressure. It's important to consider the center of pressure trajectory, which is typically not reported in many papers or many of the software, for example, but it can provide very valuable information. The central pressure trajectory, which depends on the type of software interface used in whatever system you use, gives an idea of the time in addition to the pressure distribution. So it has both temporal parameters and also in terms of the pressure distribution. So there are several papers that deal with this and discuss its useful clinical management and the footwear advice. However, the main thing that I'm trying to get at is that using different type of variables available for you in terms of pressure measurement or load measurement can add to your clinical decision-making process or the way that you design your devices. On the right-hand side, I've quoted another paper from us, which is more recent than the other paper on the left. It's again to highlight the usefulness of pressure time integral. So many of us tend to stick to peak pressure or average pressure. So it's all about what I'm trying to emphasize is variables like center pressure progression. The pressure time integral is extremely important. The pressure time integral measures that particular measure combines the time and loading, and it's clinically very relevant. So for example, one of our studies found that people with diabetes and neuropathy who tend to load their feet more heavily also tend to have plantar soft tissues with lower hardness. So this difference in tissue hardness is likely to affect the tissue's vulnerability to avoid overuse injury. That's what we have quoted in that paper. So the reason why I'm relating that back here is it's important that people just not just think about the pathologies. It's about quite a bit about measuring pressure and the usefulness of pressure and using appropriate variables. Now, measuring the load under the foot, as I've outlined in the last 15 minutes or so, is important in understanding footwear biomechanics. And the point that I'm trying to make within this slide is, in terms of in-shoe pressure measurement, there are various techniques, there are various technologies. Over the years, the earliest forms of in-shoe pressure measurement were systems based on thin film transducers, which were placed under the insole of the foot, insole of the shoe, to measure pressure. The systems have been around since the 1970s and 80s. And they were primarily used in research settings. But over the years, with the advances in technology, and there are various commercial vendors, and I'm one of those guys who use all of those systems. That I've got various systems in our lab we tend to use. And I've used one particular set of technology there on the screen. And what I'm trying to get at is, over the years, the advances in technology have led to the development of more sophisticated and advanced mat systems and also in-shoe pressure systems. The state-of-the-art in-shoe pressure measurement systems are small, lightweight, highly accurate, durable, and they can measure pressure in real time, and they can send the data remotely. And you've got systems like F-scan by TechScan or PIDA by Novell. All of these systems provide some of those variables I talked about in terms of peak pressure, pressure time integral, and also the center of pressure. And also in the middle, you have the mat-based systems such as the MatScan from TechScan, the TechScan Walkway, as some of you would know it, or the Gate-Ride system. So one of the things that I wanted to highlight within this slide is about the number of sensors. And I normally, when I do lectures, people do ask me about the number of sensors in the in-shoe pressure measurement system or the mat system. Definitely, the number of sensors in in-shoe pressure measurement system is an important factor, because it determines the level of detail and the accuracy of data that can be obtained from these systems. The systems, of course, with more sensors would provide more detailed and accurate picture of the pressure distribution under the foot, as it can measure pressure in more areas or much more detail. The system with fewer sensors will provide less detailed, less accurate picture of the pressure distribution. But the point that I want to make on the right-hand side is the F-scan 64 system. The reason why I'm mentioning this is the number of sensors in an in-shoe system also affects the resolution of the data. A system with more sensors have a higher resolution. That means it might be able to detect the changes in the pressure distribution. It's important for identifying subtle changes in pressure distribution that may be associated with certain foot conditions or injuries. So it's the optimum number of sensors. It's not that you need a large number of sensors or you can cope with one sensor. It depends on what you want to measure, how you want to measure it, and what your main purpose is. And in that sense, systems like this F-scan 64 might be enough for your use, and that's the clinical and that's the technical judgment that you need to make depending on what your needs are. And on the other hand, the advancements in technology, talking about advancements in technology, it's definitely allowed for more detailed understanding of foot biomechanics over the years. So in my earlier days as a researcher, force plate targeting, as we call it those days, was a major difficulty in gait analysis. So we tend to have people walk across our lab, and we won't tell them where the force plate is, but then we'll be there for days in the lab, and they won't be hitting the force plate. But now we've got technologies like instrumented treadmills, which opens up a lot of doors in terms of load measurement and force measurement, and which enables us with a wide range of experiments. And recently, how are we doing for time, Ben? We're okay?
We're good. I want to give you, we're at 5:01, about 5:05. We can have enough time to ask questions and.
Okay. I'll quickly run through. Recently, some of our research is focused on the loading characteristics of the soft tissues on the plantar soft tissues with individuals with diabetes. The reason why I'm looking at it is I'm trying to introduce a couple of new technologies that we use, and which relates back to loading characteristics and also the pressure distribution. We've been examining how these tissues are affected by increased load and pressure that can occur as a result of the disease or as a result of diabetes. This overall program of work aims to better understand the potential mechanisms that contribute to the development of diabetic foot complications and ultimately inform design of more effective interventions for preventing and managing these complications. Another area of work which I have not given you up there is our research group is currently exploring the use of shear wave elastography to use soft tissues in foot, to understand soft tissues in the foot, particularly the individuals with diabetes. Shear wave elastography is a technique that uses ultrasound waves to measure elasticity or stiffness of the tissue. By assessing the elastic properties of the plantar soft tissues in individuals with diabetes, we hope to gain a better understanding of how these tissues are affected by this disease and the potential targets for interventions to reduce the risk of ulcers. So one of the main variables for us is the stuff that Ben just mentioned, is about plantar pressures and also about measurement of shear. And we'll come back to shear measurement in a bit. So quickly going to the next set of papers. Again, I'm pretty certain I can provide you with a copy of this presentation so that you have listed those papers. That's not an issue. And it is about relating, again, all of these research that I'm providing you on screen has a clear focus, and main variables that we are measuring relates back to load and pressure. And what we have shown is measuring the stiffness, measuring the loading characteristics using plantar pressure. And if you use appropriate technology and appropriate techniques, we can achieve all of your clinical management outcomes you want to achieve. On the left-hand side is a 3D printed insole development that we've done, which has been the latest work is currently being written up for publication. It's pending publication on a huge clinical trial using that approach. Now, the more appropriate and more for a bedside orthotic clinics here in the UK, again, use of plantar pressures and plantar pressure measurement, how can it help you in terms of simple clinical interventions and providing an evidence base for your own work? Again, I've given you a couple of examples of what we've done in terms of using pressure measurements in getting to provide evidence for your clinical approaches. Here is another set. How does pressure measurement relates back to footwear? I mentioned about footwear choice and the life course of the influence of footwear choice in the life course of females. Again, you've got a good set of papers there which would show you that teenage girls, how their footwear choice and the clear relationship to the footwear choices made by young women and the potential impact on foot health on the right-hand side when we measured the footwear choice and the plantar pressure aspects and the impact of fit in older women who come into normal podiatric clinics. Again, you've got a whole program of work which showcases how important plantar pressure measurement is and our load assessment is in terms not only for your clinical intervention, but also for your footwear advice and also the choice of orthotics that you would give. And the other end of the spectrum is about current program of work on how to choose footwear and the footwear choice, and also tools that we are developing in terms of managing children. And here is an exciting program of work. There are more papers to come in. I couldn't stop myself from sharing this information with you. I'm just going to skip that. I wanted to talk to you within this slide. It's about the impact of footwear upper on the footwear sole. And this is where measuring the pressure distribution in the dorsum of the foot is equally important as measuring pressure in the sole of the foot. Probably we can touch on that during some of those question answer sessions. Equally, it's about the material selection of footwear, both for the upper and also for the sole of the foot. Again, the material selection is important and it influences the shear forces or the plantar pressure aspects of your interventions and your approach. Here is the latest in terms of pressure measurement. We've been working on an insole prescription concept. So the idea that people who are interested in can go and read this paper. The idea is we have got a 3D printed device, which you can give it to your patient. The patient takes it, uses it for 3-4 days a week, whatever they do. And it essentially is an automatic prescription for an orthotic intervention. So that's what we have tried with that approach. So the way forward, to finish off, the way forward, the message from me is combine new technologies and new techniques. There's so many are there. It's about use of appropriate technologies and techniques. But using these technologies and techniques, we can definitely understand this marvelous machine. And we still have a long way to go. And I wanted to kind of give you a feel for the importance of measuring pressure or force under the foot. I think I'm going to stop there, Ben.
Wonderful presentation, Nach. And I'm going to lead off the first question, which relates to pressure as it relates to compression. Ben Onig, of course, has talked about the oscillations that occur within the soft tissue compartments, those eccentric movements that sometimes cause the tissue irritation, whether it be shin splints or plantar fasciitis. You know, one of the interesting things that Dave at OS First did is they took one of these sleeves, and it's kind of an ankle sleeve called the FS6. They put it around the heel, and they found that the fat pad came in a little bit more underfoot, like it took some of the lateral margins of the fat pad if you're looking from behind and brought it under. But above and beyond that, what would be the body of knowledge that we need to investigate to understand more the proprioceptive and kinesthetic things that some of these compression devices are doing? Because obviously we have people that subjectively say, yeah, you know, that takes the edge off. You know, they'll have, just like in first aid, you know, we splint something, we put a wrap around it. What do you see as some of the ways that we can more specifically measure something that isn't underfoot per se, but around the foot, trying to manage a soft tissue compartment.
I'm not too sure if I understood your question fully, but I'll try and answer it. And if I don't,
Or just
please
any
come back.
general comments you have on, because there's been a lot of fad science on, do you get performance or athletic injury improvements with compression therapy? Those, and we know, of course, with blood flow and so forth, that has been proven, with venous insufficiency, but above and beyond that, trying to help with inflammation and tendonitis and things of that nature, ankle sprains, etc.
Yeah, in essence, it's multifactorial, isn't it? You mentioned blood circulation, and we have a program of work to look at the microcirculation aspects, the thermal aspects, and how it affects relates back to pressure. So I fully agree, and that's the reason why I said in the last couple of slides about measuring pressure in the dorsum of the foot is equally important as the pressure under the foot. Because when we have footwear, and we know for sure, and I think I presented, some of you might have seen the data that I presented, when you have a tighter fitting shoe, you've got a medial shift of the center of pressure. Obviously, that shows that it's going to create trouble in the whole kinetic change. So in that sense, when you have devices like compression socks, and it definitely influences the pressure and the function of the foot. And the other thing that people might have heard me speak about is the articulating surfaces within the joints of the foot joints, and we fully don't understand how our pressure distribution and how tight-fitting shoes or loose-fitting shoes affect that.
Does anyone else have any other questions for Nach before he gets on with his rest of his evening?
I do.
Yes, sir.
Good evening, sir. I'm Lloyd Muller, and I'm a longtime professional ski instructor. Ben knows my background, and I'm wondering if your work has been spread to the ski boot industry. This is what you're describing here is critically important, because the forces that create pressures are enormous. Skiers pull turns at 80 miles an hour, and their feet must be able to respond effectively and continue the maneuvers, the turns, and so on. Otherwise, the skier is very liable to wind up seriously injured because they lose their track. I can tell you from long personal experience that my feet are pretty warped from living in this environment. So do you have any comments here, sir?
Thanks for that comment, Lloyd. The short answer is we have done some pressure measurement in dry ski slopes in the UK in the earlier days. In terms of our novel interventions and some of the stuff that I was talking about, plantar soft tissue stiffness and all that, we have not done anything recently related to ski boots or skis. Definitely that will be an area of interest for us, and I'd be more than happy to speak to you.
I do want to share with you, both of you, and Lloyd knows Tom Gelly through another mutual ski instructor, guy that we taught with, that there is a carve system that one of my FitFoot guests, Tom Gelly, who's a professional demo ski instructor, has used, and they use that.
And he's also a physical therapist.
That is true. And he has used that feedback to coach virtually his students. So I would encourage cross-pollination there with the ski industry. And it's nice when we can not all be in our vertical silos, so that, like your World Health Organization information can be shared with APMA and ski industry, et cetera. Anybody else have any other questions before I get Dr. Simon Bartold, our next speaker?
Yeah, Ben, this is Ted Forkham. I have one quick
Ted?
question is, I just want to see if what kind of studies have turned out between some of the force pressures on the plantar surface of the foot with different width shoes, because you've had the trends of going towards, say, wider footwear towards standard footwear. So I just want to see if there's any comment on that.
There have been some studies, particularly with a focus on kind of orthotic interventions within P&O industry rather than sports. We ourselves have done some work on shoes made with various types of lasts, which we haven't published, but I think I did present in a conference a few years ago with out-flare lasts and in-flare lasts, and we used a specific company to make the similar design shoes with varying lasts, and the lasts had different widths. I think that's what you're asking about. We do have some data. We have not published it. There is quite a lot of difference, and that's important in the sense that what we tried to get at within that piece of work was patient-specific intervention or individual-specific intervention and how it differs. And we used plantar pressures and the resultant ground reaction forces as an outcome measure. Does that answer your question?
That was a great answer. Yeah, and I'll let Ted speak for himself. Ted, you're back.
Yeah, no, thank you very much. And so since it's not published, I'm not going to press you more on the outcome study results on that.
And I know that tightness of shoes is a topic that's very near to a couple of our colleagues' hearts. I know Golden, Harper, and Ray are big on that. And Ray has pointed out a circulation study that a lot of shoes, we just size them a little too tight in